Hey everyone, welcome back. Dr. Ashley here. This week's topic of conversation is going to be treating and rehabilitating the lateral ankle sprain. Have you ever been running, jumping, doing a certain task, and all of a sudden you roll that ankle underneath you? Well, this video is for you. So what actually happens during an ankle sprain? Well, if we look at it, what ends up occurring is that you have an overstretch or a partial tear to some of the ligaments that connect some of the foot bones to the ankle bone. In the lateral ankle sprain case, what we're looking at are really two ligaments, the anterior talofibular ligament and the calcaneofibular ligament. Sometimes this ankle sprain may also be associated with a strain of the peroneal musculature. However, that may not always be the case. And sometimes you also have to be on the lookout for a possible fracture because that can happen in that scenario when you roll that ankle underneath you. Now, I did just talk a little bit about tearing versus overstretching, and believe it or not, that is what will determine your grade of ankle sprain, right? So I was just about to say strain, but remember, strains have to do with the musculature and sprains typically have to do with the ligaments. So what determines your grade of ankle sprain? I'm going to go into that next. However, before I do, make sure you hit that subscribe button, and if you're enjoying our content, share the channel with your friends. So how do you determine your grade of ankle sprain? Well, sometimes a doctor will tell you you have a grade 1 sprain, grade 2 sprain, grade 3 sprain. However, sometimes you may not know. Well, there are some telltale signs between the three that may give you a little insight as to how severe the damage is to the ligaments of the ankle. Now, we can say all ankle sprains can be rehabilitated. Some might just take longer than others. For a grade 1, what you're going to see is you might have a little bit of swelling. You may not have that much bruising. You might just have some generalized soreness on the outside of the ankle, right? You're normally able to move, you're normally able to walk, and you get back up and running in a few days, maybe a week or two maximum. When we're dealing with a grade 2, this is where we're looking at a little bit of possibly a partial tear of those ligaments on the outer ankle. When this happens, what we see, definitely some bruising, a little bit more swelling than you're going to see in a grade 1, and it may ultimately be difficult to walk. You may need crutches, you may need to actually take some time off, put that foot up, and make sure that you're letting it recover. When we're dealing with a grade 3, this is the most painful, the most swollen, and certainly the most bruised. This is where we see a full tearing of some of those ligaments of the ankle. At least that is what would be seen on an MRI. When we do tests as physical therapists, right, or even as physicians with our hands, we can tell that if you have a little bit of a sprain that's worse than another, there's a little bit more laxity in certain areas of the ankle when we go ahead and move it around. So that's also another thing. But back to a grade 3, when we're looking at that, you see bruising, you see swelling. It's almost impossible to put your foot on the ground because it's that sore. And this is ultimately the one that is going to take the most time to heal. And what it needs is a little more protection and a little bit more rest. The next step of this video, where we're going, is talking about how you take care of these things, what you should be doing in the first phases and what you should be doing in the second phase to get you back to doing what you love. So make sure you stay tuned. So you've sprained your ankle. What comes next? Well, the first stage of taking care of an ankle sprain is protection, right? We always say that in the first 3 days, you need to make sure that you're minimizing swelling, taking some pressure off of that area, and making sure that you're doing what your ankle needs. This includes compressing and elevating, not necessarily icing as once thought, and actually, believe it or not, avoid the anti-inflammatories. We need a little bit of that inflammation in there to make sure that our body starts doing what it should do to heal. Also in this stage are 2 other things that you really should be focusing on. You should be focusing on your range of motion, right? Doing some ankle pumps, doing some side to side, kind of windshield wipers we'd call them, and working on ankle movement such as writing the ABCs with your foot. Now, during all of this, your pain level should remain below a 4, and it should not make your swelling or bruising get any worse. After you've done that and after you continue to work on your movement and the swelling goes down, it's time to normalize your walking. And that is part of this first stage of rehab. We want to make sure that as you go, you get back to a normal walking program and that you don't underestimate the power of walking. Remember, as you walk, your ankle has to move through its full range of motion, and it's extremely important. So you're back on your feet, you're walking a little bit more normally, you have some movement back, and you feel like you could start doing a little bit more. So what comes next in rehabilitation of lateral ankle sprains? The big thing is that you need to take your time. Based on your grade of ankle sprain, some of these things may take longer to get back to doing than others. And remember, your rehab is going to be different than your friends and your neighbors and everybody else around you who's ever sprained their ankle. The reason being is everybody heals differently. So after you've gotten back on your feet, the first thing that you start doing is working on the specific strength of your ankle, right? We're working on the stabilizing musculature. You're gonna do things such as a 4-way ankle banded exercise. So where you push your foot down, out to the side, in and up, right? And you can see that right here. What I recommend doing is doing 3 sets of 10 of each of these to begin. And then after you feel confident with that, you can move into the next step. And the next step is really working on ankle mobility. I'm only going to show you one ankle mobility exercise here simply because this is the one that I see most impacted as a physical therapist when it comes to ankle sprains. And this is actually called dorsiflexion. So what I'm going to do, go ahead, I'm going to be close to a wall, about a fist away from a wall, and I'm going to work on kind of moving my knee over my toe forward. Now remember, during all of these exercises that you're about to see, your pain shouldn't go above a 4, right? And it shouldn't necessarily cause any more swelling or bruising as you go. So just keep that in the back of your mind and work on your ankle movement a little bit. And what I recommend here, say 15 to 20 repetitions of this, and this is actually not bad to do on both sides. All right, next up, what you're gonna do when rehabilitating that lateral ankle, you need to make sure you start working on your balance. What I recommend doing first, work on static balance, meaning standing on one leg just like this for say 3 rounds of 30 seconds. Once you can do this comfortably and once you're not toppling over or you don't have a lot of pain, then you move into doing dynamic balance tasks. And basically watch the video, see what I do here, and give it a shot yourself. What I recommend for doing these is say try to do this for say 20 to 30 seconds on each side and try it for 3 rounds. Remember, your ankle should not swell more and it should not be in significant pain. After you work on your balance, next up comes functional tasks. This is basically generalized strengthening for your body, but also there are things that you need to do on a regular basis. If you need to pick something up off the floor, if you need to get on and off the toilet, if you need to kind of climb stairs, that's what we're looking at. So these are a few exercises that I recommend going through, right? 3 to 4 sets, 8 to 10 reps. Next up on the agenda are things I like to call return to run tasks. Many of us post ankle sprain, the one thing that you want to get back to doing is running or even just moving a little bit more. Now, in order to get to that point, you have to work on some basic plyometrics. These are what I'm going to show next. You're going to work on what we would call double leg pogo hops, progressing to double leg multi-directional pogo hops, followed by the single leg category. When we're looking at running, what's really important is being able to do 30 seconds of a single leg pogo hop. The reason being is running is a series of single leg hops, and that's extremely important to make sure that you're getting to the next step. Now, when you do return to run, what we recommend are doing walk-run intervals just to get yourself started. The whole goal is that you do walk-run intervals incrementally until you can get up to running 45 minutes at a slow, steady pace before you go ahead and add in intensity and the return to sport components that we're about to get into next. Now, after you're running, you're feeling really great. You really want to get out on the field. However, you need to make sure that you throw in some return to sport tasks. Return to sport, return to play are not the same thing. So when we're talking about return to sport, we're talking about things such as agility, acceleration, deceleration, cutting, right? And maybe some of your ball skills or anything that you do in your sport, some climbing skills. However, we're really looking at it on a less intense base than if you were going to play on the field. So what I recommend here, doing some ladder work, right? So doing some different types of ladder drills, doing some agility work, such as this X drill, or even doing, say, AT drill. There's many out there. I'm not gonna go through them all, but you wanna make sure that you're comfortable doing things such as changing direction, pivoting, jumping, and moving just as you would in your sport. And once you feel confident doing this, then you move into the last step, and that's working on your return to play. When we discuss return to play, it always starts as a non-contact option first, progressing to kind of light play with maybe being a neutral player, and then getting into a full contact scenario. You can't rush through all of this. The reason being is once you have an ankle sprain, you are more likely to have chronic instability of that ankle unless you rehab well. So don't skip the steps. Make sure you go through return to sport and return to play and get yourself back on that field or climbing or hiking or doing whatever you want a little bit better and a little bit safer. Well, folks, that's all I have on ankle sprain rehab for you today. If you have any questions, if you want to learn more about this topic, don't hesitate to post any comments or questions in the section below, and we'll be sure to get back to you as soon as we can. Just remember, everybody's rehabilitation from an ankle sprain is going to be a little bit different, and it's important not to rush. The reason being is that you need to make sure your body is well prepared. So as always, Dr. Ashley checking out, and I will be back soon with more information.